600,000, they say, will be deadly. But now, one of the top 10 medical breakthroughs of the year that could help these patients is happening right here in Cleveland. Hello, everybody, and thanks for joining us. I'm Tracy Carlos. We're learning about groundbreaking new technology from Case Western Reserve University to fight against the deadly disease that touches so many people. News 5's Homa Bash is here now to explain. Homa.
Tracy, it's called smart imaging, using computers and artificial intelligence to predict if cancer patients will actually benefit from chemotherapy or if they'd be better off without it. Technology that can save time, money, and trauma. What's happening in this room could change cancer treatment forever in the U.S. and around the world.
This opens a whole new gateway for what personalizing a treatment for somebody means.
Using artificial intelligence to look at images like MRIs, CAT scans, and tissue biopsies beyond what the human eye can see. For example, the computer technology can detect patterns and then determine if you even need chemotherapy.
Whether you have cancer or not, whether you've got more aggressive cancer or less aggressive cancer.
The groundbreaking research is happening at Case Western Reserve University. The team, led by biomedical engineering professor Dr. Ananth Matabushi.
And what we've shown for breast cancer patients and more recently for lung cancer patients, that we can figure out whether you need chemotherapy or not. And that means that a large number of patients might actually be able to avoid chemotherapy because they don't need it.
The goal, Dr. Matabushi says, is to reduce the number of treatments that patients undergo, whether it's surgeries, biopsies, or chemotherapy.
Right now, just way too many of these patients are being subjected to procedures that are completely unnecessary, traumatic to them, but also extremely expensive.
According to a recent study in the American Journal of Medicine, 42% of new cancer patients lose their entire life savings within 2 years because of the cost of treatment. Besides the financial trauma, there's also the physical toll that it takes. All of that, Dr. Matabushi says, is what they're trying to combat with their technology.
So we know, for instance, that there are a lot of patients out there who get a cancer diagnosis, but we know that a lot of them end up getting overtreated, overdiagnosed.
The researchers say the goal is to get this technology into the Cleveland Clinic and area hospitals within the next 2 years. Homa Bash, News 5.